So restorative dentistry is essentially restoring the tooth back to its original state. So restorative dentistry can address teeth that have cavities, it can address teeth that have fractures, it can address teeth that have big wear facets, it can address many of the problems that just come with wear and tear of chewing, eating hot foods, cold foods, acidic foods. So in determining the best restorative options for a patient, it's mostly assessing what's gone on, how long's it been there, how big of a problem is this. Mostly what we want to do is be as conservative as possible to keep the original tooth structure as strong as possible and in balance and free from bacteria. So restorative dentistry is helpful in somebody's overall health because we're eliminating disease within the tooth structure. It's a funny thing that teeth, when they get infected, which is called a cavity, you don't feel it until it gets super close to the nerve on a tooth. That happens, then we're flirting with that possibility of the tooth dying and needing a root canal. So catching this early on is going to keep your general overall health more healthy. We're getting rid of the bacteria and the disease processes that just show up in the mouth. And that way we can keep people healthier and strong and the teeth stronger.